welcome. Welcome to Health Wave with PIPH. We're excited to have you with us today. We're here to talk about March's National Brain Injury Awareness Month, and excited to have you as our guest blogger.
In-house blogger.
In-house blogger, that's right.
I'm excited to be part of the team.
Okay.
Yeah, it's a big topic, and it's such a wonderful one to touch base on because everyone's heard of concussions or brain injuries, and a lot of times, unless it's really something that's quite prevalent or has really affected someone in such a drastic way, we don't realize how much it can be impacting us in a subtle way and what that might be doing to our health or our growth or our development.
Right, and we're learning more and more that subtle brain injuries can be cumulative and actually affect us long term.
Yes.
As we hear more and more about sports injuries and things in professionals, and there's lots of course, research going on into the area of brain injury. So I know in pediatrics, the most common thing I see are concussions as brain injuries, and most of those, just resolve on their own in a day or two, and people get back to play. But now we have these big, return to play, return to school playlists that people have to go through 5, 6, 7, 10 days of kind of slow rehab to get back into their sports, into their activities, even into school.
And I think that's really brilliant to give it a little bit more attention to the magnitude of the trauma that's affected on a brain level and how that can affect the being as a whole. So and sometimes it's something small that the body can clear quite usefully, and sometimes it ends up being, like you said, those many cumulative ones where we don't even register that the previous ones have even occurred, because a lot of times, even in an intake, I'll ask a mom or a teenager if they've ever had a concussion, and a lot of time the answer is no, and it's very rare to make it even to the age 10 with never having a concussion. And this might be like more of a grade 1, but we don't necessarily get those labels, and it's not about necessarily marking someone as having one, but just knowing the history of what the brain has endured so that we can help clear and some of those traumas or restrictions or inflammation patterns that may have been set up.
Great. So what do we see with a brain injury? What's happening?
So a lot of times it is inflammation in the brain is one of the key players. And with concussion itself is often an impact. And a lot of times we think of concussions as literally getting hit in the head and thinking that has to be a component within getting a concussion. And it's one of the most common ways to get it, but actually it might even not be the most common way, but it's the most familiar way that we receive concussions.
That's what I see in my practice, of course, is somebody gets hit or a cheerleader falls on her head, and a kid slips and falls and hits their head on an object, and that's when we see a concussion.
Or even, a very classic is this is me swinging a bat, like the baseball bat, like accidentally hits the catcher, something like that. Yeah. Exactly, another player, things that are very classic of how a concussion would occur. But there's also a lot of other common ways, meaning common that they happen often, that we don't catch, which is those falls to our tailbones. I see it a lot with like skateboarding, either to the sit bones or even the tailbone, the small of the back. You can land just on the sacrum, and it's literally like a tidal wave up the cerebrospinal fluid into the brain that comes up and slaps a part of the brain. So those quick jolts, oftentimes with deceleration injuries, where we have like 2 kids collide on the soccer field, for example, or even 2 brothers running around the house that are just having a grand time, that have a little too grand of an impact, or the kid that turns around fast and runs into the coffee table and he hits his shin but falls backwards. So there's this whiplash of insults to the amount of pressures in the brain that it's like so a lot of times when we look at injuries that are direct to the brain, you can tell if there's an impact. There's also often the opposing side of where that transfer of energy has gone. So inertia gets the shift in the brain, and the brain itself hits the other inside part of the skull.
That's so it's the Contrecoup injury, right?
Yes. Yeah. They've always got these great fun names. But so it can be if multiple directions. So if we're in a car accident, for example, there's often multiple. So it's like the initial and then your reflex against it. So it can be multiple directions where it's almost like a mini pinball machine, and the ball is actually the brain inside of its container. So you've got this beautiful container, which is the skull, and then the brain, which is the content within it. And then even more so within those, you have all of those organs within the brain and the signalers that tell us to do things like warm up or cool down. So all these great regulatory systems in the brain that also excite us or even tell us to dream, invite our body to make melatonin so we sleep at night. So there can be sleep disturbances or things that happen visually, can affect things like learning, processing, cognitive. And so you'll see that in really even in the movies where people really have the exacerbation of those symptoms, but it can be small that show up, and we want to help make sure that if that inertia, if that information is coming into the brain, that we help it come back out, so that it's not just something that is reoccurring incident or trauma to the brain.
Right. I think that's one of the key things that people want to hear or that the awareness month is about, is that the injury is not just a physical injury, that it can affect you physically, but it also can affect you emotionally, cognitively, affect your learning.
Yeah, there's some research that has shown also that there has been some correlation too with even just a fall like when you're ice skating or on black ice, where you don't even necessarily physically hit the skull, but you just have a sharp, fast hit to the tailbone or on the sacrum, the small of the back, that causes a depression. And so there may not be a awareness of that link, but when you help to clear some of those tensions in the system, that depression lifts. So it's incredible the effect that these impacts can insult the body as a whole.
So that reminds me of a time I fell on the ice and hit my tailbone and had a headache like the next couple of days and didn't feel well. But that was actually a concussion. Even though I didn't hit my head on the back of the ice, I fell, slipped, ice skating, boom, didn't want to go the rest of the day, didn't want to drink my hot chocolate. I just wanted to go home.
Yeah.
So I probably had a concussion.
It is. And it's
Nobody
quite
would have thought of
shocking
that,
to the
right?
system. We never talk about that. Like literally, again, I don't want to say I pick on skateboarding, but I grew up skateboarding and snowboarding. And so I got to experience these in my own body. But you also see this where, like, even on a vert ramp, where if somebody were to come out, or even jumping off of a playground, things where, or even off of the upper bunk bed in some of my instances, where you jump off and it's almost as if the readiness to response, like you still landed on your heels or on your feet, but the jolt, like if you've ever bruised a heel, or even if you fell forward and your arm came out, and so it braced you in that beautiful reflex that you didn't hit your face or hit the head, that there can be a strong enough jolt where, so for example, if you were to put your arm out and the energy were to go through you, you might get like a sprain, right? So there'd be this great movement that happens. But let's say that it moves through and it doesn't make it, the energy that's transferred through that impact doesn't quite make it through the tissue and get stuck in the bone, then you have a break. So the energy has to disperse, so it gives you that clear, like, that impact had to go somewhere. And so sometimes it goes through an extraordinary shift in position, and then you'll get a sprain of the ligaments across those joints. But if it doesn't get that distribution through movement, that energy has to move through in some way. So it can go into a bone and you'll have more of a bone break. It can go into the joint and you might have more of a sprain. It can go up and transfer through the connective tissue up into the brain. And so that's how we get these injuries to the brain that can be, again, all over the gradient. You can have a quite severe concussion without ever hitting the head. Same thing with like whiplash, being on a roller coaster, things like that.
Yeah, that's extraordinary, and we don't think about it, right? And of course, probably wouldn't even be diagnosed as a concussion, like in the ER, urgent care, or even maybe some primary doctor's offices.
Yep.
Yeah,
so it's amazing. Incredible. Without hitting the bell, you can actually still ring the bell.
Right. That makes sense, right? If you hit the bottom of a wine glass, it still will ring the bell of the glass.
It's a beautiful thing too, is that even with the osteopathic approach, in that we're incorporating here at PIPH too, is that it's great to learn all these things, and regardless of giving it a label, that we can do something about it is what I find profound. In that the system, the brain, the body, the nervous system is quite adaptive, and it wants to feel good. It wants to be in its place where it moves well, where it digests well, where it sleeps well, and it feels good. Its mood is happy. And so it's always trying to find its way back there when it's literally been knocked off of its axis, or the pendulum has really swung in one direction. So through these hands-on therapies, we really can yield great effect through working on the cranium directly. So there's times when we can work right on the brain itself. There's nutrition that can be used to take some of the inflammation out at a cellular level. And also the thing we don't ever really think about, like when we get the wind knocked out of us, like if you fall on your back and you like you literally like takes a moment to regain, to you literally got it, the impact moved out of the body. There's this cabin pressure that changes between all of the cabins of the body. So I think of it as all the great planes of the body, and starting up at the penthouse is the brain or the cranial pressure, and then you've got the thoracic pressure in our ribs, and then the abdominal pressure where our digestive organs are, and our pelvic pressure, and they're all in a gradient and always working together. So it's really quite wonderful to, when one has affected the other, or if one has a big impact, the influence that over time occurs in the others. So there can be digestive issues that show up after concussion. And there's a lot of research now that shows in both directions, leaky gut, leaky brain, and leaky brain, leaky gut. So you can get a concussion regardless of if it's through the head or through the body, that within 5 minutes, they have documentation that the gut junctions also go into shock, also in open. So now you've got leaky gut, which makes us more vulnerable to pathogens or different things in our environment. So it can cause global inflammatory response or aches and pains and things of that sort. So we just want to be aware of those. And what do we do when that occurs? And how do we help prevent that from being a new pattern in the body? How do we flip the switch back to that pre-state before the impact or injury happened?
Right. And we're learning so much about the what we're calling the neuroplasticity of the brain, or the brain's ability to recuperate and actually regenerate. And I was just reading more about that again with Deepak Chopra today. Well, can you speak to that at all?
Yeah, so that's again one of the things why we're so resilient. The mass of the brain itself really is quite aqueous. It's very juicy and fluid. It's got a lot of lipids or fats in it. And so it's really dynamic and very resilient. And so one of the things that I love about neuroplasticity is when we talk about neuroplasticity is that its ability to shift or adapt. I've been kind of a prime example of this. I had my first brain injury that is known was when I was age 5. I had a fall off of a playground, and it was from quite a height, and so it was kind of high velocity, and my hands weren't out, so I was kind of hanging from my feet, kind of utilizing the jungle gym in a playful kid way that maybe it was not designed to. And it was in those times where we didn't have those great rubbery floors, it actually had like a metal graded floor. So there were a couple of eras that occurred and lined up the stars perfectly for this to occur. And with that said, my brain was able to move around the injury and really utilize different parts of the brain for reading. And I was 5 at the time, so like my reading, writing, my 3 R's, my arithmetic, all of those great things were still developed well. And knowing what I know now, I look back and thought, wow, imagine if we didn't have this ability, where we would be as a society. And so we have this great dynamic to keep moving forward. But had I had the insight, or my parents were aware of this type of therapy, which is slowly growing back in the US and in Western medicine, of helping to, through cranio-osteopathy and craniosacral therapy, through visceral manipulation and neural manipulation, really coming in and being able to help shift the pressures within the nerves by hand. It's very light. It's wonderful to receive, and giving the body essentially a voice in how it's moving through, so that we don't set it up for various different patterns that can occur after an injury. Sometimes we don't even realize they're related. It could be like 3 months down the road that we start to have indigestion show up pretty consistently, or our sleep patterns really thrown off, or we're quite sensitive to light, or some of the common things that show up, or chronic headaches, an increase in irritability. And so even if it's not a major or like a grade 5 concussion, it's really nice to, when we have those impacts at a smaller level, to help clear those out, because we're finding that secondary concussion or those accumulations are tenfold. They're many times worse than just getting, so it's not 1 + 1 concussion equals 2 in the magnitude of it. It's like 1 + 1 is more like a 10. So we want to really be aware of when they're recurring, so we can just simply help clear it out of the system.
You started to mention some of the things you use to do that, craniosacral and some of the other things. How is that effective? What happens physically that you can do outside the body to affect the brain on the inside?
Well, it's quite wonderful too. So if there's something that has happened physically to the brain, whether it's direct or indirect, by working directly on the cranial, both the bones and the sutures, so you've got that great content or the container of the brain,
Mm-hmm.
where we can help to decrease pressures or help to regulate if there's been a little subtle shift. And so it's not something that's so grand. Actually, sometimes you can see that there's like almost like a distortion that can occur in the facial bones as a reaction of what's happening in the cranium. But a lot of times it's a lot more subtle than that. But there can be enough of a little bit of a shift where that just helping something like the brain, the bone in the center of the skull, for example, this beautiful bone, it kind of looks like this butterfly, and it touches
Mm-hmm.
all the other bones in the brain. It's called the sphenoid, but sometimes that can get kicked off to a side. It's kind of got one wing that's higher. There's ones that are back that can affect the jaw and swallowing. So if we can help to harmonize and regulate how, basically help to just modulate everything into harmony again, so that the pressures of the cranium start to equalize as well. And then with the work directly on the head as well, we can also do work where we are still working on the skull itself, but kind of creating a bit of a compression. It's very light, but it's enough to get feedback into the tissue. So I kind of allude to this when I'm chatting with families on the table, that it's almost as if I were to describe a club sandwich. So if I were to put my hand, this will make sense in a moment,
Uh-huh.
might make you hungry as well. You put your hand on the top of a club sandwich, you can feel the toast. You can feel the temperature, you can kind of feel the firmness of the toast, right? So I allude that to the actual hand
Yes.
on the skull itself. And then if I give a little bit of a press, so I just bring it layer by layer, I'm still on the toast. I can give it a little pressure, and then the next thing I feel is a little buoyancy, and it's a little deeper, and it's the tomato, for example. And then if I maintain that and I give it a little more pressure, now I'm aware of in between that layer, I can feel that it's denser and it's a little firmer, and that's more the bacon. I can give a little press, and so I still am on the toast, so I'm still on the skull, and layer by layer I can feel slide and glide. So I'm on perhaps some serious fluid, or the fluids that slide and glide the fascial structures between the brain and the skull, so that they're not adhered to each other. And if I can feel a little bit of an adhesion, it's kind of where the bread has stuck to the mayonnaise. It's not gliding right under that surface. And so just having a great knowledge of anatomy, so really studying what layers are under the skull and getting a sense for that palpation. Just like I'm not touching the tomato, I'm not touching the bacon or the turkey that's in there, but when you know the density, you know the size and shape of it, you can get a sense of it under your hand. And so that's really how we're starting to address where there are pressures, where things become a little bit more glued, where the mesh in the fascial bindings become less lubricated. And what happens when those are occurring is not only inflammation, but it decreases the ability to get nutrient and fluid into those tissues and metabolic waste out. So we have this current flux always, our cerebral spinal fluid, or this beautiful fluid that basks both the brain and the spinal cord. And we really turn it over about 4 or 5 times a day. So it's not just a pond. So that's the beautiful thing, is as the research keeps coming out, and it's not necessarily specific to these types of therapies, but what I love is that the research helps support what we've been finding in the clinic for decades. And even before I came in, hundreds, maybe not hundreds of years ago, but since we've been doing this work. So it's been really quite beautiful to see the research now support what we're finding in the clinics. So we're able to see and support how we're getting that cleansing of the brain that helps to clear out some of the inflammation on a cellular level and just natural metabolic waste of the cells of the brain. So the wonderful thing is not only is it we have an awareness of what's really occurring at a cellular level, but we can do something about it. And that's where these hands-on therapies come in.
Yeah, and that's really beautiful because so often in my office in the past, it's always been, yes, you have a concussion, go to sleep, rest, take your Advil, and if it's really bad, we'd send you to the neurologist, and they
Right.
would pretty much say the same thing. So we're
Right.
really excited to have you as another option for kids who get injuries, whether it be concussion or other kinds of things, to take another look and get another bunch of options. I know you've not only worked just on the skull, but I know you work a lot on the cranial nerves that come through the skull and where those come in and out of the brain to give more feedback in and out of the brain, like you were saying.
Yep.
Get the metabolic waste going. So empty the trash from the brain so it's
Exactly.
not building up more
Yep.
toxins and things.
And we do it. I mean, our bodies are brilliant. It does it all the time, but sometimes it just needs a little guidance. And sometimes the other thing when we really talk about children is that not only can this happen in sport or in play, it can happen if you fall out of bed. Um, it can also occur during the birth process.
Yes.
So, for example, there could be extreme pressures if we spent a lot of time in the birth canal. There could be sometimes with something like a C-section, when necessary, there's this urgency that occurs. And in that timing, it's a different type of cabin pressure for that infant because the cabin pressure is literally shifting in moments as we safely remove the baby from the womb. And so that cabin pressure can change the cabin pressure in a system. And again, because we're resilient, it often 90% of the time we self regulate, but it's like a lot of those, that 10% of the time, that small percent of the time, or if it's just a little bit that didn't fully clear, that's where other things can show up, whether it is difficulty in feeding. When we are working with infants, it's such a joy because they can't think their way into like a placebo that it's working or not working. They just simply over the next few days their ability to nurse increases, their sleeking, their ability to turn a certain direction. If they have like a particular position that they're always holding an arm or they only roll one way depending on where they are in their development, it's incredible to see those things shift after a session, sometimes immediately and sometimes within the next 2 to 3 days, as we're basically increasing a particular input or awareness into an area, gently giving a conversation between the brain and that body, where that conversation continues through the rest of the next couple of days. I often think about these types of in-person hands-on treatments as the treatment really begins as it ends. So when they're walking out the door, because now their body gets to get that new input, and every time they take a breath, it's naturally changing their compression, which is lengthening the nerves or helping shift the brain and the pressures. And every time we take a breath, it changes and it empties these. We have these great little ventricles in our brain, and they're like these little tiny ponds that carry the cerebral spinal fluid in them. And so we literally, when we're taking a breath, it's like getting this respiration at that level. So it's changing the cabin pressure in our brain. Sometimes even when I'm working with the hands-on work, I'll have someone literally take a big breath and hold their breath and close their eyes. This increases the cabin pressure of the brain. And that gives me a really clear message of what part of my club sandwich, what part of the brain has the most tension in it. And that then gives me basically the input I need to help have a conversation mechanically. So when I'm working with the body, really it's more proprioception is what we're waking up. And we're getting some mechanical reception as well, right? So those mechanical receptors. But when the body then leaves, it's its internal breath, its movement. Even if you're to an age where you're walking or playing your sports or even doing your homework, all the things that you're doing now are moving a little bit differently, and it's really super subtle, but it's then allowing that tissue to increase its conversation and its glide. Yeah, it's really incredible. It's really incredible how well it's linked and how well we can help clear and remove these before making it in, before they accumulate into what could be really a serious problem, or create a pattern that might be a little bit more difficult to help clear and repattern into the body or into the hardwiring of the brain.
Yeah, we're all familiar with the circulation of the blood, but we don't think about the circulation in the brain and in the spinal column and all of that. And now that's all connected.
Yes.
To everything else in our body.
Yes. And
mind, body, spirit.
Very much so. Very much so. It's incredible how much your body does in any given moment.
So since we're very active people, even despite COVID and things, what would you have for recommendations for prevention of brain injuries? Do you have anything that you'd recommend right off the bat?
If I were to give you, so the goal is always to never get a brain injury.
Right.
So I would say just some of the prevention would be just being aware of your surroundings. So sometimes I would say most of the smaller things, like if you've got a kid on an upper bunk, just having that little bar. I myself fell out of my upper bunk several times.
Me too.
Right. So it's all these little things that just kind of accumulate, falling out of a treehouse, off of a swing set, things like that. And it's not about not doing those things. I still want kids to play in their swings. I still want kids
climb
to
the tree, right?
creative. So some of the prevention of having it be something that lives or hangs out in the nervous system or in the brain and creates a problem later would be, I would say the first thing I would invite somebody to do is after they receive some type of impact. So to the head, to the tailbone, to the heels, it's the last thing you want to do in that movement or in that moment. But if you can either whistle or hum, you can start to get a nice connection between the brain and the gut to help start to mend some of those junctions that get shocked and literally like open up, that we were talking about. That's kind of my over visualization of like a leaky gut or leaky brain. And so it's a way to calm the system down, so you're going back into that rest and repair versus like a fight or flight, which even if you are finding yourself like into a place that you feel safe, it's like you fell, you're not falling again, that just letting the system know that you're okay and helping to shift that. So even just literally a hum, like where the mouth is closed and you're breathing through the nose, it also gets the respiration, so you're getting the carbon pressures back into place. So taking a couple big breaths, and it could be a fun song like ABC, it can be just something you can think about, and it doesn't have to necessarily, I mean, you can fully sing if you'd like, but just getting that to kind of move through, or even, whatever it might be, I'm okay, like whatever it is to get that vibration. And the vibration is really moving through some really key nerves, and those that might be familiar, that vagal nerve that we're learning more and more about, and that effect in connection to the brain and the body, to make sure that your system can come back on board. Because it's kind of like when you turn your computer off, only there was an error and it shut itself down. And so its reboot can be a little bit sticky, and you're like, I hope it turns back on. Or like when you drop your cell phone and the screen blanks and you're like, it's gonna come back online. How are we doing here? Right. So it like almost slowly reboots, and you like gently watch it turn back on, and you're like, fingers are crossed. That's a great way to help the nervous system, which is what's taking the majority of that input, and really trying to dissect it to make sure, or kind of see what just happened. Starting to do like a self-regulation check. And especially if somebody has been knocked out, so they're literally coming back. So finding that place of where their system can really start to, that is like the cell phone's ideally turning back on. And so it can be really disorienting. So that, and hydration is huge and key. The minerals in our body. So some simple things is just staying really hydrated and making sure we've got minerals in our system. So a lot of times there's the essential key minerals in the body can really be depleted. And it's not necessarily that they get knocked out of you, it's that you're utilizing them at a high rate. So there's simple things like magnesium, and that's something that, for example, isn't necessarily tolerated at high levels really well in most forms orally. And so you can use topical magnesium, or Epsom salt baths can help to really get magnesium in elevated level into the system because it's going to be used at a rapid rate, particularly with brain repair and after a brain injury.
Without giving you diarrhea, which is
exactly.
common.
Exactly. Yes. Nobody wants that.
Right.
And that's the opposite of hydrating.
Exactly. Keeping the hydration is so important. What do you think about anti-inflammatories?
I think that anti-inflammatories are huge. I find that I really like things that are going to be a little bit more natural in that aspect.
Okay.
So we're not necessarily turning off some of, if there was a small bleed or if there was something that the body needed to mend, so we're not turning off those mechanisms. But there's a lot with something like turmeric is a nice anti-inflammatory. Resveratrol, ashwagandha, I believe, is also quite good with the brain as well. So looking from the Ayurvedic standpoint, which is now a lot of places are finding a combination of those in some supplements so that we can help heal without bringing in the liver or kidney in terms of it. We really want to quench that fire. So I often think, like, how big is the fire? And the fire is the impact or the inflammation. And so how big is the fire? How much do we need to extinguish it? So if someone's taking a lot of those anti-inflammatories, we know that those aren't great long-term. They're great when needed and they're beautiful. We don't want those to be set up as the path of a long-term cure. They can be helpful on the quick fix to really just help to quench those fires. But again, I really love to try and see if we can do it in a more natural form that's going to help take out the inflammation without having the side effect of what could be happening in the stomach or the processing that occurs in the liver that also has to process everything else that's happening at the same time.
And there's some concern, I think, about platelet function. So we don't want to affect the platelet function in a brain injury where that could cause more microbleeding or even gross bleeding into the brain.
Right.
So I usually don't recommend something like ibuprofen until it's at least a day out from the injury.
And similarly, a lot of times if there is an impact injury that is directly to the brain, I often will have people wait a couple of days unless they can get in like right away. There's like a 24-hour like acute window, and really 4 to 6 hours is that acute window that we can start to address right when the body's still processing it. And then after that, I kind of picture it like salt in a cup of water. The salt is really still stirred up. So there's still a lot going on in the system. And I want to wait for that salt to settle at the bottom of the cup as I go in. Otherwise, it's like a lightning storm in terms of there's activity everywhere because the body's still really processing. And so a lot of times if we can't get them in right away, then the hands-on in terms of the work really 2 days, 3 days after will be more beneficial than trying to get like a day after when they're still quite in the mix of it.
Sure. All the body's chemicals are just all in a rush, like you said, in a storm.
Yeah.
It's kind of like letting a snow globe settle, right?
That's
it takes a lot longer. Yeah.
Yep. And some things that do help, again, and if we can do it, and like you were saying, because we want to avoid some of those other over-the-counter drugs, and the supplements may be used right away. So I find that those seem to be a little bit safer and helpful in quenching that fire.
And you mentioned magnesium. Were there other
Magnesium's one of the biggest ones. But I would say in general, I would want to go with all of like the minerals. I would want to make sure like electrolyte and mineral levels are up to par. And again, we're going to be utilizing them more than what would be like what we consider the daily recommended value. Right. We want to really, your body's using them fast. So it's using them more than it typically would in a day, for example. So it would really depend on body weight and the age of the child versus an adult on how we're kind of looking at that. But the great thing with minerals is it's not something that we can easily overdo that would be harmful.
Like vitamin C, when you're sick with a cold or respiratory illness, you pound through that and need extra right up front.
Yep. And they're not something that's specifically fat soluble, so you're not going to start storing a whole bunch in your system.
So the only thing I was thinking of prevention is just wear your helmet.
Yes. Oh my God.
So right, like so for bike or skateboarding or any, even on a scooter, we had a really bad injury on a young girl who was on a scooter and was going down a hill, not terribly steep, but a hill, and ended up in the hospital with several weeks of brain injury recovery, and then they're still recovering months later. So wearing her helmet or wearing your helmet when you're doing any kinds of those activities.
Yeah. Yeah, it's everything from bike riding, because that's the thing too, right? Like you could literally be riding your bike and then you just tip to the side.
You just hit a rut in the road, right?
And this is what I always tell people. It's similar to a seatbelt, right? So like wearing your helmet
that was
when
the
you're
other
going
thing.
skateboarding, when you're riding your bike, when you're riding your scooter, when you're
Snowboard.
playing football, when you're up to bat at the playing baseball, right? So we wear those for a reason, right? So it's not like those just randomly came into the world. When you're roller skating, that's a big one.
Right.
So all these great things it can help so much, because when you see it, right? So when we talked about like the impact of an injury, and in this case to the brain, when you fall, we talked about it could go into the joint and you get a sprain, right? So that's the other beautiful thing with the work that we do with the hands-on, is a lot of times there is some strain that happens in the cervical, so your neck gets a little bit of strain or pressure on it. Yeah, exactly. So there can be mechanical. So in your brain, you also have in the center of the brain this beautiful piece of connective tissue called the falx that becomes the casing and the covering over the brain and the casing on the spinal cord that we call the dura. There's not a quiz, you don't need to know those words, but it also covers it's got this great tentorium. It's like this tent that covers the back of the skull, where you have your sensory and cerebral motor cortexes, right? So you've got these motor control rather, and so it's covering the cerebellum. And so when you get impact, it's to disperse that energy. So that's what your helmet does for you. So instead of your built-in helmet, which is your skull to protect your brain, you get a secondary helmet, so that when you crack your helmet, or you get a nice badge of like even a tree branch. So when I was skiing, for example, I've had tree branch marks that you'll see from skiing in the trees, that were just these scrapes on my helmet, and I thought, thank God that wasn't like the pine tree and across my skull. And so we've got all this great technology to help build that on top of us, so that the energy isn't going into breaking the skin or breaking the skull or putting impact onto it. It gets to take that impact for us, because that impact, that energy, it's inertia, right? It's just the law of physics. And so we want to have that distribute through the helmet, not through us. So that's a beautiful thing. And if you do have a big injury with a helmet, and big meaning more than 12 miles an hour. So for skiing, I used to be a competitive snowboarder and coach. And so I know some of these fun facts particular to that. But to give you an idea, that at 12 miles an hour, is where the impact will be taken by the helmet, but you'll still get it into the cervical, right? So like if I hit my head, I'm still getting a compression, and it's coming either into, again, you can have a little minor sprain into the neck. And so with the hands-on work, we can help working on individual fibers within that ligament itself to help balance out and self-regulate. So we change the input of where the strain may have gone into those ligaments, because in the spine itself, it's over 20, it might even be up as to 46 ligaments that come in per vertebrae, right? So if you picture all these ligaments and tendons like a tent poles, when you go camping, if there's one that's off, the tent's kind of pulled down or up, or like it can't withstand the wind as well. And so you want them all, and they're there and they're pliable, so that when the wind comes, or when you're moving around and you're in your tent, they move around too. So you want the ability for them to self-regulate and let you move around and side bend and rotate your head without strain or pain, but also functionally, so that the nerves that are going through there can have, because everything that's coming into the full body has to come through the spinal cord, right? Aside from those cranial nerves, they're going straight through the cord. So everything, including what moves your pinky toe, has to come through the neck, right?
That's your hardwiring, right?
So it's one of those beautiful things. And even breath patterns start to change, because if there's any strain, and if it's up into, right, we say like C3, C4, now it can affect your breath pattern, not only from if you get the wind knocked out of you, but if you get a whiplash or hit your head and your helmet takes it, thank God, but your neck gets a little bit of a shift. You might not be aware of it, but now your breath pattern has changed, because that phrenic nerve, so the nerve that tells your diaphragm to expand and soften, has a little bit of a change in cabin pressure. So we can go in and help to adjust that, both at the level of the diaphragm, so we can be down where you breathe and those ribs are. So you might have a head injury, and I'm working on your ribs. And so
Right.
I'm working on your diaphragm, and it's relaying the information back through that gorgeous nerve into your brain. And so there's this beautiful mix of how much what happens in your head affects your body, and vice versa. Like you get sideswiped, or you get, pig piled on by your siblings, or on football, or you fall on your surfboard, whatever it might be, where you get a little like impact to your ribs. Now that pressure that has shifted perhaps that location can affect how it's coming into the brain. So it's this two-way street. So whenever I work, you'll often I don't even want to say often, you'll always find that even if I'm working on an ankle injury, I'm going back and checking the brain, because your brain not only is going to map the pain and the input of how that injury happened, but I want to make sure we're making changes on the cranium, and the brain is assessing what you were doing, because it's picking up the information when we're adjusting an ankle, for example. So it's we're always working with all of it, but the brain is the boss. It's the CEO. You want to keep it happy. You want to make sure those hormones are at a good rate. And the simple things, even like melatonin, are we sleeping? So there could be patterns of sleep that are shifting, and what's happening in terms of what has happened mechanically to our body that can be a shifting in a way that we didn't know that those crossroads were so intimately affecting one, influencing one another.
Yes, it's really great to realize in so many ways, and the ways we keep learning about how our brain and our body is so interconnected, and how you can't separate one from the other.
Yes.
Without
I
some
love how
without some major injury or,
yeah,
or
exactly.
problems. Yeah.
Without some decapitation.
Right.
But the beautiful thing is, it's what I love and love and love about our practice is that we can do something with this great research.
Right.
So it's not just this great article like, oh, this is cool, this is something that has potential, or we have the potential to do this. Not only do we have the potential, but we have the tools. We have a center that we're building, so you have a place to go, so that we can help these kids and these humans, and whether someone is 65, 99, 105, or 5 minutes old, there's something
Right.
that can be done to help to shift a dynamic that maybe is less than optimal in that system.
Really great. We're so glad to be working together, and with you and our acupuncturists, our naturopath, and our other practitioners in Ayurveda. An honor to come together and celebrate this month brain injury, and realizing that probably all of us have had a few brain injuries along the way and can all use a little help. So if your child is having any trouble with an injury to the brain, or even that wasn't the brain but is having problems, please come see us. And it's been a joy chatting with you, Roeshan. Thank you so much for joining us here on the Health Wave today. And we look forward to chatting again about other topics throughout the year.
Very much so. Excited to be here, and excited to help those brains and those kids just keep thriving.
Grow up to the best potential that we can.